Hello, a warm welcome to CREST.BD's Bipolar Wellness Center webinar series. This webinar will provide you with a summary of current research evidence on the relationship between spirituality and quality of life, as well as pointing you to some tools and resources to help you flourish in your spiritual life.
Hi, my name is Victoria Maxwell, and I'm a CREST.BD member. I'm also the owner of Crazy for Life Company and a mental health speaker, actor, and writer. It's my pleasure to welcome you today, and today we are going to be speaking about the domain of spirituality, of spiritual. So first, the webinar focus, we will start by defining spirituality, religion, no easy task, why spirituality might be important to your quality of life, some information around spirituality and bipolar disorder, and then some tips and tools about how you can take action if you choose to enhance your spirituality. So let's get started. So defining spirituality and religion, like I said, it's no easy task. Interestingly, 90% of people in the world participate in some sort of spiritual or religious practice. So that's the majority of people in the world. It can be defined as something that an individual finds sacred or awe-inspiring, and spirituality is inside or outside of formal religious practice. And then religion, of course, is within a formal religious practice. Now, in terms of defining spirituality, it can be expressed in many different ways, and often spirituality, people participate in spiritual practices when people are in distress, going through a difficult time, when things feel uncertain, and it can give them a sense of connection. So these are some ways, and maybe you relate to some of them, and I'll share some of my own experiences, but you can express it as acts of compassion, deep reflection, meditation or prayer, walking in nature, enjoying nature. Often people can go hiking, reading poetry, literature, spiritual teachings, engaging in creative activities, which can vary for people. It can be anywhere from cooking to more traditional artistic pursuits like painting or writing. Belonging to a faith tradition or community, so going to church, and then maintaining relationships with a high level of trust and intimacy can also be considered a way of expressing spirituality. Now, why could spirituality be important to quality of life? Well, it can support a number of different things. It can support learning and growth in difficult situations. It can support the ability to cope with illness. And it can support feelings of connection and compassion and belonging with the universe. These are things that all of us need, and in particular we'll discuss how it relates to bipolar disorder. So interestingly, and this is something that I wasn't aware of until we started doing some of this research, is that there's two styles of religious or spiritual practice. The most common is what's called a positive style of coping, and as I said, it's the most common, and it is a source of comfort, compassion, direction, growth, gives guidance. And then the negative style of coping in terms of spiritual or religious practice is called negative style of coping, and it's less common. And it's where it can be a source of guilt, where there's often narrow-minded or closed-minded thinking, blame, or fear. And obviously that can engender feelings of feeling isolated or potentially bullied. Now, why could spirituality be important to your quality of life? Well, spirituality may have some positive benefits for mental, emotional, and even physical well-being. It provides social support and sense of belonging. It increases emotional resilience, so the ability to sort of bounce back from negative events. It can actually lower blood pressure, and it promotes exercise, and it can reduce the risk of suicide as well as reducing substance misuse. So it has a wide range of benefits in different areas of our life, but it can be very important and beneficial. Now, there are some challenges around spirituality. Some spiritual beliefs don't necessarily agree with medical advice and treatment. And some systems of belief, particularly the negative coping styles, can make people feel bullied or discriminated against. I know I was talking to a woman who, within a faith tradition, it was difficult for her. She wanted to go into treatment, use medication, and there was sort of different perspectives on the use of medication within her faith community. And eventually what happened was she was able to talk with her pastor at the time, and there was education around that, and she got support. And that was really helpful for her, because for her, her spiritual practice was really in alignment with her faith community, and it was important for her to have her faith community support her. Spirituality and BD, hyper-religiosity, which can be a symptom of bipolar disorder. It can also make you question the reality of your spiritual experiences. So in my experience, I went into psychosis, manic psychosis, and it was tied into a meditation group. And it was also a time where, at the same time I had very florid psychotic symptoms, I also had very peak spiritual experiences and things that were very profound for me, and they were all interwoven into one. And so what was difficult was teasing out what was psychotic features and what was important to me personally and spiritually meaningful. And what was difficult was that I didn't reach out for help right away, because I really felt that there was either that my whole experience was pathologized as a mental illness. And so for me, some of those profound spiritual experiences, those what might have been seen as hyper-religiosity, they were very important to me. And at the same time, there were some that were really maladaptive. So it wasn't until I found a psychiatrist who was able to help me hold both and validated that I could still have a profound spiritual experience. And that didn't necessarily mean that I didn't have a mental illness, but that didn't diminish what I had been going through. So it was really important to tease out those two elements so that I didn't either continue to postpone treatment, or that I only went down the road of medical treatment that ignored something that was very important to me. In terms of warning signs that spiritual ideas, which can be very intense in times of mania or depression, they can sometimes be an early warning sign, and they can be confusing when experienced in a mood episode. They can also be complicated by cultural factors. So in some instances, the symptoms of mental illness in some cultures can be seen as spiritual, versus in a more, let's say, North American or traditionally Western perspective, it's seen as a disorder. So those are other factors that can complicate the issue. So what actions can you take? Well, in terms of spirituality, it's extremely personal. So there's no right way to practice it. What feels right for one person can be not right for another. But some ways that you can start to investigate or explore what might be meaningful to you spiritually is ask yourself what keeps you going in hard times. So when you're under stress, when you've been having difficult life situations, what is it that allows you to move forward and continue on? You can learn about a variety of spiritual organizations in your community, and that can be from very traditional to churches, synagogues, temples, things like that, all the way to more sort of like spiritual but non-religious, where it's mindfulness groups, meditation groups, people just discussing spiritual matters. And you can look at your inner resources and outside supports. So inner resources are how you may want to practice. Inner resources may be practicing on your own, and outside supports may be being in a community of people that are like-minded. The other interesting thing that you can do is look at mindfulness. And the official definition that I have is that mindfulness, which is really actually exceptionally good for coping with mental health challenges, is a practice that tries to develop an attitude of acceptance and purposeful awareness of the present moment to cope with life's suffering and to increase overall wellness. So it's a way of dealing with life's stressors, life's challenges in a way that allows you to stay present both with the suffering but also to overcome it. And there's resources in the Wellness Center that directly speak to mindfulness. Other ways that you can take action is openly discussing spiritual matters with your supports. So speaking to your healthcare providers and your other supports like family, friends, peer counselors, because it allows them to understand what's important to you in terms of spirituality. It increases your own understanding as you start to explain it, and it develops a holistic recovery plan. So for myself, when I started talking to psychiatrists about my spiritual experience, when I met my psychiatrist that really heard and understood my experience, we were able to incorporate that into my treatment plan. So he was very clear that he couldn't be a spiritual counselor, but it was important for me to find a way, particularly to find meaning of my psychotic experiences and the spiritual elements and put it into context. And so I sought out a spiritual counselor, and he was, my psychiatrist was great with working that into the treatment plan. And his only caution was that making sure that the work that I did with him was distinct from the work that I did with my spiritual counselors, so that there wasn't sort of overlap or conflicting suggestions, or if there were conflicting suggestions, to make sure that I brought it up to both of them so that they were in alignment and I didn't feel that I had to find some way of reconciling these two opposing views. And that actually, surprisingly, it didn't happen. And it was a really wonderful blend for me because it honored the fact that I had gone through something spiritual that also happened to coincide with the onset and episodes of my bipolar disorder. And it was an essential part of my recovery, and it was actually the turning point where I really became proactive in my treatment plan. And in that way, my healthcare provider and my spiritual advisor worked collaboratively. They never talked with each other directly in my case, but there was an understanding that my spiritual advisor knew that I was working with a psychiatrist and vice versa, and there was sort of an agreed upon plan of how we would go about this. So I think it's really important to make sure that things are working in collaboration, because otherwise it can start to be more confusing. So some tools and resources for you. These are just a few tools, but we have outlined 3 in particular. This is on YouTube, and it's Dr. Nancy Kehoe of Harvard, and I've actually had the pleasure of meeting her, and she's a wonderful individual. She has a background as both a psychologist, a doctor of psychology, and a nun. And this in particular is Conversations on Religion and Mental Illness, and it's brief discussions about spirituality in the context of mental health challenges. And it's got a variety of guest speakers as clergy, spiritual leaders, healthcare providers. And Nancy Kehoe in particular has been a real forerunner in helping to integrate spirituality and mental health care. Additionally, there is this paper, Healing from Within, Spirituality and Mental Health, by Dr. Larry Culliford. And as it says, mental health is much more than the absence of mental illness. So it's taking an approach of how to look at one's spiritual needs and care as a factor in both symptom relief of mental illness as well as general well-being. The last one is the Initiative on Health, Religion, and Spirituality. Spirituality and Mental Health. It's Harvard University's research on the relationship between religion and mental illness. And it includes a list of publications for further reading as well. So these are some really interesting evidence-based tools and resources. So for more information and resources, please visit our Bipolar Wellness Center at bdwellness.com, and you can assess your quality of life using the quality of life tool, which includes one of the domains, the spiritual domain, at bdqol.com. Finally, I'd like to acknowledge people who have made this possible, and particularly our funders, CIHR, the Canadian Institutes of Health Research, among a number of others. And so thank you so much for joining me, and I look forward to hopefully you going to the Wellness Center.
Thank you, Victoria, for that webinar. It's now time for the question and answer session. And we have some that have come through already, and here's a great one to start with, Victoria. The participant asks, given your personal experiences, what advice would you give to people about distinguishing between psychosis and a spiritual experience?
It's a great question. Hi, everybody. I think for me, with my spiritual experience and my psychotic experience, one of the things was being able to distinguish how to even learn how to distinguish, which sounds really like a difficult thing to figure out. I had a recent sort of psychosis about a few months ago, actually, and I say a mini one. They never seemed particularly mini, but it wasn't something that disabled me. It didn't continue to escalate. And I think part of what I started to recognize was that I did reality testing. So there were times where I remember feeling like the light in the room was starting to glow brighter, and I thought it was something happening from the inside, that it was a transcendental kind of experience. And what I chose to do, because of my past, I said to my friend, I said, did you see that light come on? Or, because I didn't know where the light was coming from. And she mentioned to me, she said, yeah, there's the kind of, not incandescent lights, but the other lights that sort of take a while to fade up. And all of a sudden I recognized that, okay, so it wasn't that all of a sudden I'm glowing from within, or that the walls are glowing from within. There was this light that came from very fact-based evidence. So I think that kind of reality testing and checking with people, and particularly with people who I trust, so that if I feel like something's slightly strange, and for those of you that have been in psychosis, you sort of know that feeling. There's a certain surreal kind of feeling that can happen at the very early stages of psychosis. And as soon as I start to acknowledge that, because I want to distinguish, I don't want to minimize something that I do feel is significant or profound for me. I don't want to immediately pathologize it, that like my psychiatrist often did. But I also want to make sure that I'm not reading into something more than it is. So that was one way. And then to find out if it was something that I felt had a personal meaning, usually what I find is that those experiences are things that bring me a lot of joy, a lot of peace, a lot of deep contentment. And the psychoses often are quite frightening. And so even if some of the aspects, I'm thinking in particular where something that can feel spiritual, where for no particular reason, where I'm walking in the forest and I just feel, surrounded by a real presence of love. That's such a powerful experience. Nothing's dramatically changed, but I have a real palpable experience of feeling that kindness. And one of the things that I've noted particularly is that it's not accompanied by a sense of paranoia, usually. So it's a difficult balance, and I think close friends can really be helpful. Supports can be very helpful in doing that reality checking, which I think is important to be able to discuss psychotic experiences and spiritual experiences with someone that won't judge them, won't initially take one side or the other, but really help you explore. You think that answers that, Erin?
Yeah, it's so interesting. I think you're talking about checking in on the emotional valence of an experience as a form of reality checking, and that's something that really resounds with other people's narrations that I've heard.
Yeah.
Here's an interesting and challenging question for you next. How do you respond when you meet people who tell you that mental illness is something that's caused by the devil or some other evil power?
Well, and I've met people who have had that experience in an indirect way, where this one woman who was went to a church, and it wasn't quite saying that it was the devil, but it was saying because her faith wasn't strong enough. And there's a real difficulty because people are being more or less somehow blamed for their illness, or in terms of evil power, devil, that they're weak, so that's come in. And so my experience with that is first respecting that where they come from, that's their belief, but also being able to present some information. So depending on how close that person is, if the person isn't someone that I necessarily will be seeing in my close circle of friends, I may not invest a lot of time in trying to convince them otherwise, because it depends on how solid their beliefs are around that. If it's really important for me to find some common ground, I like to give some information and direct them to websites that can give them information about the biochemical, the genetic factors, the medical factors. I also like to pose a question to them and ask, do they feel the same way with cancer? Do they feel that cancer is caused by the devil or an evil power? Because oftentimes there's a gap between physical illnesses and mental illnesses. And so I'd really ask them, saying, so why is that belief different, if it is different? Because then people have to start to question why they've made a distinction between a physical illness and what we or they perceive as a not physical illness. So I think part of it is assaulting them with the facts and also but doing it in a respectful way. And the other part to me of that question is self-care around, is it worth my energy to rebut that? If I feel like I'm just going to be getting into a power struggle and an argument, or if it's actually something where I do feel like I need to make a stand, and I'm actually going to feel better about myself by discussing the truth and the myths that they're sort of under around the illness. Do you think that's sort of
making a thoughtful decision about whether you engage and not necessarily engaging on each occasion?
Yeah. It's similar to when people, make some sort of insensitive or ignorant comment about mental illness. Really choosing whether or not to, like you said, engage in a conversation, because sometimes it's important to do so, and sometimes it's really not.
Mm-hmm. To the next question. This is a nice one. In my experience, spirituality is in some sense a faith that everything will be okay, that there's a flow of life, and that things can happen for a reason, so I can learn from them and come out better on the other side. So is this a common experience or benefit for people who practice spirituality?
I understand that it is. It gives us some coping tools, because typically spirituality is the cornerstone of people's way of being able to move through the world in difficult times. And so I think it also helps us create meaning out of these challenging situations that we might not otherwise understand why they're happening, and allows us to move forward. And I think that's a really great word about the flow of life. So knowing that as we have difficult times, we also have easier times, and life is a constant flow. And so being able to talk about it and have a framework and world perspective that gives us a sense of meaning and semblance is a way of actually coping better, so that when challenging times come up, we're not thrown off into a crisis or a panic. And ironically, even if we are thrown into a crisis or a panic, we can still rely on that and allow ourselves to have faith that things are still going to be okay, regardless of how I'm coping. So there's days where I'm coping better and other days where I'm not, but there's a sort of a undercurrent underneath it all that allows me to sort of be kind to myself and to trust, which is sometimes very difficult with mood swings in particular. Do you have any comments on that, Erin?
No, that was a thoughtful response, Victoria, and we have lots of questions coming in, so let's press on to the next one.
Okay, great.
This person asks, how does somebody go about finding a spiritual advisor?
Oh, that's really great. Well, I think it depends on what you perceive your spirituality to be. So some of it might be more straightforward, that if you're interested in meditation or you're not sure, you might want to join a meditation group locally. One of the things that I often did was also pick up a few books to get a sense of the flavors of things. So, you know, you can do mindfulness that is connected to Buddhism. You can do mindfulness that is not, and it's connected to John Kabat-Zinn's stress reduction for not mindlessness, mindfulness. And that's another opportunity for me, because what I was going through, when I had done some reading, I felt that I had gone through what is typically called a Kundalini crisis. That can have psychotic features in it and things like that. And I had been reading something about Stanislav Grof, and so I recognized that it was considered a spiritual emergency. And this wasn't to say that it wasn't also tied in with my mental illness, but I had found a website that there's a couple of spiritual emergence networks, one within Canada, there's one in the UK, there's one in the States. And I phoned and I talked to someone there and I said, do you know of any experienced therapists that have been, I told what had happened. I told that I was working with a psychiatrist at the same time, and did they have any recommendations? And I was referred to a couple of people. And so that was some of the other resources that I had used at the time that was really helpful. And then I think when you meet with people, really check in with your intuition and your felt sense of whether or not this is a really good fit, because you really want to make sure that it's something that aligns both with your medical treatment, psychotherapy treatment if you're having psychotherapy, as well as the spiritual one, because I think one of the most difficult things is if they start to contradict each other, and it's difficult to reconcile at times. I'm trying to think if there's, and other things too, is that being able to talk with other people, friends who might have a strong spiritual life, and find out where and who they sought out in order to get that. Simple things of going to a yoga class and talking to people there, and just seeing who or what people recommend. What about you, Erin? Do you have any thoughts on that?
I think that's really sage advice, particularly your last point, you know, speaking to trusted people in your social support system who you have an existing connection with and networking through that existing network,
Yeah, and I think that's it. Is it's sort of like getting a recommendation for a good real estate agent, although it might be a bit more difficult to find because not everybody seeks out a spiritual advisor. And so my spiritual advisor, I mean, you can have a very traditional one where it's a pastor or a minister at a church. It can even be where I live. There's a Tibetan Buddhist monk who you don't have to subscribe to Buddhism, but you can go and visit him and ask him questions. And the woman that I saw did energy work and Reiki and certain spiritual practices, and so it was on a much more alternative but complementary to my own beliefs as well as the treatment that I was receiving.
To the next question.
Yep.
When you say there are some potential physical benefits to spirituality, do you know what aspects of spirituality are being referred to?
Well, from the research that I've been reading and from my own sort of experience, there's a certain kind of emotional resilience that was actually referred to in one of the past questions about better coping skills, better able to come back to a set point when you're faced with challenges. It has to do with trust, faith, being able to move through crisis with a little bit more resiliency. And some really basic ones is lowering blood pressure. It promotes exercise. It reduces substance misuse because I mean, for me, what has happened is that I had disordered eating for many years, and a lot of my spirituality also allowed myself to acknowledge and to reduce the anxiety that I was feeling, which can be part of bipolar disorder as well, or concurrent. And so for myself, it helped reduce my anxiety levels, so it reduced the need for me to go to food to comfort myself. It reduced the depth of the depression that I went through because I had a certain faith and a certain worldview that allowed me to have meaning to this world, and I didn't feel like I was sort of stepping on groundlessness all the time or living in uncertainty all the time. And the other thing, too, is it brings social support and a sense of belonging. So a lot of times what I find is that I can have very deep, meaningful conversations with trusted friends around this, and we share both our challenges and our victories, or whatever, our neuroses, and being able to talk about it in a way that is really meaningful and that goes more than just sort of through the superficial layers of friendships, which can be still fun, but not always as satisfying. Do you know any other ones, Erin? Those are the ones that sort of ring true for me in my own experience.
Nothing that springs to mind, but I'm eager to round off with what looks like one of our last questions that's come through in this webinar, which is really around the interplay between spirituality and healthcare systems. It's kind of a two-question and bounces off from what you were discussing before. It asks, what would you have done differently so that maybe your first psychiatrist would have supported your spirituality and practices more? And what can you suggest people do if their treatment teams don't understand how important spirituality is for them?
And the first question was about to help my psychiatrist support, or if they didn't support my spirituality?
Exactly, yeah.
Okay. I think part of it was that I was not talking about it with them. I was really afraid that if I talked about it, it would be labeled religiosity or dangerous. And so when I first did a tiny bit of conversation and it wasn't going in a positive direction, I shut down and didn't continue the conversation. So my two thoughts are, have an advocate with you that can help express those things, because I find that sometimes, particularly in the early stages of diagnoses, it's difficult. I found it difficult anyway to be quite assertive with my healthcare providers. It was difficult to express things, particularly if I felt that they disagreed. So having someone that understood my spirituality to come with me to help me articulate better, so that I didn't feel intimidated. Even if my healthcare team wasn't trying to be intimidating, I often I would just act submissive. So that's one of just a real practical tool. And then the other one, in terms of expressing it, I think part of it was if I had been able to talk to them without getting angry at them right away, and being able to say, so I am clear that there was some psychotic aspects. I'm not denying that I have a mental illness, but I also need you to recognize that there are these very important elements that I felt helped me get closer to the divine, and try to educate them in a way about being able to say that I know that I want to find a way to continue to distinguish between the two of them and understand what their concerns were, because I know my first psychiatrist's concern was that if I continue to dive into meditation, that I might continue to trigger more psychoses if I wasn't eating and I wasn't sleeping and things like that. So for me, I think it would have been better to talk about saying, no, I still want to meditate. Can we find a way that you feel would be safe for me that doesn't mean that it's an all or nothing? And so I think that would have given an area of compromise and a way of being able to also talk about, if they felt saying, well, why do you have to meditate at all? And then being able to say, because it's part of my quality of life. It's the way that I connect with my core being, my sense of belonging in the world. And so understanding what their concerns are and being able to find a middle ground between the two. Because I think sometimes they also have very, very valid points that I need to take into consideration as well. But when I felt like my voice had been squelched, that was when trouble sort of started, because I stopped talking, I stopped communicating, and I just wanted to do things the way I wanted to do them, which wasn't fully informed. So I think that those are probably the two things. And I think also talking about what the warning signs would be. So if we agree, let's say if meditation is my practice, or doing Tai Chi or Qigong, saying, being able to outline things. So how would I know that this is being of a benefit to me, and how would I know that it's not being a benefit to me? So pros and cons, and working it very deliberately with my healthcare team, and to say, okay, so we'll try this and see what happens, and then try it again and see what happens, and then build on that. And part of it is, I think, building trust for both sides. Any thoughts on that?
Yes, really good advice there. One of the recurrent themes that's come up through these webinars, Victoria, has also been the idea of planning when well. And I'm also wondering about sort of creating a treatment plan potentially if you are going to go into an inpatient setting that states on paper, that spirituality is something that's important to me. It's written when you're well. It will be important to me if I'm, say, in a hospital setting, still to have some time that's quiet for meditation or whatever my spiritual practice is. Is that something that you've heard before?
I have. I mean, I haven't heard it in terms of the spiritual aspect, but in terms of saying, what's really important. And also, I think what's important to write down maybe what are triggers for me that aren't helpful in terms of spirituality as well, because I know that if I'm going inpatient and I still want to hang on to my spirituality, but if I'm still not able to have a lot of objectivity, there's been a tendency for me to, let's say, well, I don't want to sleep, I don't need to sleep, I'm just going to meditate. That being able to write that into the plan as well, saying, I need to limit it to 20 minutes or to 30 minutes a day or something like that, just so that, and writing that while I'm well, so that there's sort of limitations around it, but that give it sort of some safety nets as well.
That's really good advice. Well, wonderful. Thank you to everybody who's joined us. I think that's the end of our question and answer session for today's webinar. Thank you for all the questions that have come through. A special thank you at this point to our speaker today, Victoria Maxwell, for joining us. That was a wonderful presentation, Victoria. Thank you very much.
You're welcome.
It's wonderful to have your expertise. And thank you, everybody who's joined us for this webinar today. Hope you have a wonderful day.
Thank you.